A very important health issue that doctors really asking parents to be aware of: undiagnosed congenital heart defects. Joining us now is Dr. Benjamin Toole, a pediatric cardiologist at Children's Healthcare of Atlanta. Good morning to you.
Good morning.
This is something, right off the bat, we have to say congenital heart defect. It's a phrase maybe we've said before, but maybe we don't really know what it is. How do you define this to people?
So congenital heart disease is structural heart disease that you're born with. It occurs in about 8 out of every 1,000 children.
Wow.
So quite common, it's something that I will say with further advances in technology are being picked up earlier in utero during pregnancy. And states like Florida and Georgia and most states in America now have mandatory pulse ox screening, where it is picked up prior to the baby leaving the hospital after birth. But still, there are many cases where it's picked up later.
This is something, obviously, you're talking about your baby's heart. This seems like something that could really change their life from the second they're born, maybe even before that. But can kids who have this, they can have a totally normal life if they get the right kind of treatment? Oh,
sure, absolutely. There are varying forms. There are mild cases that may resolve on their own. There are severe cases that require multiple surgeries, lifelong follow-up with a cardiologist, and some restrictions in activities. But absolutely, with advances in surgery, advances in technology, children with even severe congenital heart disease are living long, healthy lives.
Science making great technologies for us.
Absolutely.
Now, this is something you mentioned that a lot of times women, when they are pregnant, you can identify this, but sometimes things are going to get missed. Sometimes the way I have to imagine the baby is positioned or the way things are, you can't quite tell right away. So what is the next step then for parents who maybe are seeing some red flags or maybe they're worried?
Sure. There are symptoms, particularly in infants. Symptoms such as poor feeding. All babies can be a little bit of picky eaters and a little bit slower eaters, but poor feeding, breathing fast with feeding, and then at rest. Not gaining weight or failure to thrive. Blueness around the lips particularly. Often babies will have some blueness in their legs and things like that, but profound blueness around the lips or around the digits, the hands, can be symptoms in infants. And then as kids get older, they can be different. They can be chest pain, they can be palpitations or sensed heartbeats, fast heartbeats. Certainly in any young athlete who's running down the football field and passes out while playing, that's a red flag immediately and requires medical treatment and evaluation. And
how important is that early diagnosis, that early detection, and getting that treatment early on?
Sure, it's critical. It's important, I think, for the parents' peace of mind. As I said, some things that are picked up later are mild and may not require medicines or surgery, but the sooner you know about it, the better, and the better the outcome.
And you can never be too careful when it comes to your own kids, right?
Absolutely not.
We certainly appreciate all this advice, and we saw some of the symptoms there that you were mentioning that parents maybe should be on the lookout for. You saw them there on your screen, and we will be sure to link you on our website, WTXL.tv. You'll also be able to watch this interview one more time so you can get all that important advice. Dr. O'Toole, we certainly appreciate it. Thank you so much for being here.
My pleasure.
Stay with us. We are back in just 2 minutes.